Okay, so welcome everyone. Welcome to the webinar, our February webinar for the UN Regional Hub for Big Data and Data Science in Africa. And I just first wanted to share with you who we are. What is this? If I can find my slides. Okay, bear with. You will see. Can't now go into. Sorry, everyone. Okay. So we are the UN Big Data Regional Hub for Africa. We have a website, which is there on this screen. We'll share these slides with you at the end, so you've got access to all of this. But I'm just going to do a short introduction to say, who are we? What are we doing? Well, the Regional Hub for Africa is a collaboration between the National Institute of Rwanda, based in Kigali, and the United Nations for the Economic Commission for Africa, based in Addis Ababa. The mission of the Regional Hub is to support all of you member states, as you start to embrace your journey with big data and data science. We want to support you in effectively using alternative data sources, applying appropriate data science tools and techniques, which should help you provide credible and insightful statistics. How are we going to deliver that? Well, the things we focus on are sharing knowledge, like we are doing in this webinar. We want to share with you newly developed methods, new algorithms and tools. We want to share this via webinars, our new newsletter, and we're going to soon start doing blog posts. We also want to try to facilitate some cross-border working. So some projects that maybe 2 or 3 of you are interested in, and we can wrap training around that. And that would help you to apply big data with alternative data sources, data science, and complement official statistics, or even fill the data gaps for SDGs. And we also aim to be offering more training around the use of big data science, and for you, the community. And we are soon going to be updating our website to point to lots of different training resources that are available to you, because we realize that at the moment they're all in different places and we need to bring them all into one place for you. So watch this space and we'll share that with you as soon as it's ready. Today's webinar is exciting. It's about an R package that's being repurposed or repurposing R code into a package for better civil registration and vital statistics. Your speakers today are Diego Lara de Andres, apologies for my accent, Diego, who is a data scientist, a senior data scientist at the Data Science Campus at the Office for National Statistics. We have Pamela Kakande, statistician, the African Centre of Statistics, here with me in the ECA. And we also, I'm hoping, has joined Ms. Liana Koita, who's a senior statistician in migration and vital statistics at the Namibia Statistics Agency. The webinar today is going to run like this. Here I am. I'm Kerry Regan. Sorry, I haven't said, hey, I'm Kerry Regan. I'm helping support the UN Regional Hub with ECA. I'm doing a little intro and just welcomed our speakers. Pamela is going to start by sharing this new R package for CRBS data, and then Diego will take over, and I think you're going to run some demo and share some links, because all of the code is available in GitHub. And then Ms. Liana is going to share how they've applied this at the Namibia Statistics Agency, and then we'll close. So I will, without further ado, Pamela, I'm going to hand over to you to start your section, if that's okay. And I'm lost there. Apologies.
Okay,
So
thank
Pamela,
you
if you're ready.
Thank you for the introduction. I have a PowerPoint slide that I just want to run through. And I'm trying to put it in full view. I hope you can all see now. So
Yes.
I will just, the introduction has been done. I'll just dive into the presentation in the interest of time. And my task is basically to give an overview of the package for civil registration and vital statistics. So I'll start by just talking about what civil registration and vital statistics briefly, then talk about the report production guides that exist, and then the current collaboration and the VS report package. And going on to the first slide, what is civil registration and vital statistics? This is a definition that we probably all may know, or some of us may not know, but simply civil registration is defined as the continuous, permanent, compulsory, and universal recording of occurrences and characteristics of vital events that pertain to the population, and as provided through a decree or regulation in accordance with the legal requirements of each country. So the vital events that we refer to in this context are the birth, adoptions, marriages, divorces, death, and causes of death. So all these are responding to two sustainable development goals, as you can see them on the screen. And to be able to respond to this, that's where we need to produce a vital statistics report. And we recommend that all countries should at least produce an annual vital statistics report, even if the data that they have regarding the vital events is low, or even if the system is not fully complete. At least countries should endeavor to produce an annual vital statistics report. This report, of course, helps the country to assess the gaps and strength of the civil registration system, as well as monitor the trends of key population indicators, while providing demographic and epidemiological measures to inform planning. And definitely this information highlights inequalities and inequities in service delivery across the social and health outcomes. So to produce that report, there is a toolkit that has been in place. And the toolkit constitutes of a guide, which outlines what should be included in the report, and the template that a country that can use to start developing the report. That's a Word document. And then it also has an Excel workbook that assists in calculation of some of the indicators, production of the tables, graphs, and figures. So in addition, or to try and enhance this toolkit, within the framework of transformation and modernization of statistical systems, UNECA collaborated with ONS, as already alluded to, and produced a shareable R package, which we are referring to as the VS report package, that is the gist of the discussion today. And this is was developed so that it can be applied to administrative records and produce vital statistics reports based on the standard guidelines and templates that have been in place. So the second output of this was an R pipeline that chains together a series of operations on data in a clear and readable manner to output statistical visuals and graphics for the reports. Then, of course, to carry this forward, our training course and materials were also developed, tailored mainly to cleaning and processing of civil registration data. So the package and the pipeline are in essence complementing the existing vital statistics report production toolkits. And this is what the report, Vital Statistics report contains. It contains 8 chapters in total. So the pipeline comes in to help the country process its raw data related to birth, death, marriages, divorces, so that easily generate. So it's part of the report. The first part is really a narrative. So going into the package is accessible at the GitHub of the African Center for Statistics at that address. And the repository in there is the VS reports. It contains scripts and configuration files that you need to run the CRVS report. And the scripts in there mainly focus on data processing and then generation of tables and graphics, as already mentioned. So to get started, you will either clone or download the repository, given that it's on a GitHub. If you already have your GitHub, you just clone it. Or you can go the option for downloading the zip file and extract the files, or have a copy of the package that is in a separate repository. So here I want to just say to run the pipeline, you need to ensure that you have R already installed on your computer and installed the necessary packages that you need to go through. Then the package is also has a sample data set or a test data set that you can use to try and probably train yourself or acclimatize yourself with the package before you continue. Then after you're done with that, you would ensure that you have loaded the current version before you load your country data for the pipeline, and the necessary variables that you have, given that not all countries collect the same data. Some collect certain variables and others do not collect some of the variables. So you need to ensure that you're picking out what is necessary for you to run the pipeline in an automated and modular manner, because it's set out in modules, as you will see. So when you're done with that, then your tables will then be automatically generated into CSV tables. But at the end of this, all these CSV tables have been programmed to be moved into one single XLS workbook for simplicity. So in essence, you have all your tables in one workbook, which makes your life easy to start writing the report. So the bigger task or the greater task in using this pipeline is the customizing part, and that's where you need to take a bit of care and caution. And this brings in both the persons that are doing the programming and the subject matter people, and ensure so that you have to ensure that you change the path for your raw data and the processed data, because at this point you're now working on your computer, your personal computer, not in the cloud or wherever you are working from. Then you also update to be sure that your output tables and figures are saved where you can easily access them. That's of course a given. And like I mentioned, you need to select the tables that you want to run. So at this point, you're actually saying, I'm selecting table 3.1. Table 3.1 is a numbering that is in the standard guidelines for the Vital Statistics report. So you need to have the guideline and the scripts hand in hand to know what table you're going to generate. And of course, mapping of the variables, because the pipeline uses standard naming of variables. So and countries also use different names for the variables that they use. An example is you have a country naming a place of birth as a variable for place of birth as place of birth. Another one will name it as P birth. So there are different ways of naming them. So the package is at the pipeline is giving a standard way of naming these variables. So you have to ensure that these are in sync with what is in the pipeline, and then add or modify tables and their corresponding functions, because the pipeline tries to generate all the recommended tables in the UN principles and recommendations. So you pick out the ones for which your country has data to produce. So having talked about the package, after we had developed it, we rolled out and tested in 6 countries last year in August, starting with Uganda, Malawi, Nigeria, and then we also worked with Namibia, South Africa, and Zambia. Those are the 6 countries that the package has been rolled out so far, and we've picked lessons and different lessons, successes, and challenges from the rollout to contribute to the package. So at this point, of course, we welcome contributions to the package. Since it's on the GitHub and it's free access, there are guidelines that you can follow if you wish to contribute, critique, or add anything to the package. And I must say the package is, of course, licensed under the MIT license. Those are the authors that we have worked with, colleagues from ECA and ONS contributed to this work. So finally, I must say that the CRVSR pipeline rollout, at least in those 6 countries, was a successful partnership between SCS and ONS, and we documented lessons, successes, and challenges for future projects where I would have SCS collaborating with another institution in such an endeavor, and also to inform further engagements with the member states, because the countries had to provide feedback or evaluate the process in general, and also develop their action plans on how they will proceed. So we welcome you all to engage with ECA and ONS to learn more about the new package and to ask any further questions on how you can obtain the free code and actually implement it. So I would end at that point and hand over to my colleague that will demonstrate the package to us all. I thank you all. Over to you, moderator.
Amazing. Thank you very much, Pamela. Oh, Sarah, I don't know if you want to come in, but happy to.
No, all good.
Dive straight in. So the plan now, I'll show you some of the repositories that Pamela was mentioning, and then we'll try and show you how it works. We'll see that config file, for example, and we'll try and run it with that sample data. So first of all, I'm going to share my screen. Hopefully you can all see it there. So here, this first repository, there's three key repositories that I think are very useful from this work. The first one is this R4VS, which also has a website version, and I'm sure we'll share the links after the session. But this contains that documentation and information about how to use R for civil registration and vital statistics. And here, for example, you can go, it will guide you through the setup. So how to download and install R, getting it set up, making sure that everything's kind of set up properly. So not only how to set it up, but how do you check that everything's set up right? Also around downloading and installing Git. So this will allow you to download the package and download the pipeline very quickly, and how to set up your GitHub account, again, especially if you want to contribute. So not only does it cover this, It then covers more practical things with some examples. So for example, if we look at data cleaning, like Pamela has said, everybody has different ways of collecting data. So maybe for your specific case, you might need to adjust some things. Maybe you want to classify certain things in different ways. So for example, if you have a registered birth of weight 0, maybe you want to give it the mean weight, or maybe you want to give it, you want to remove it, or you want to give it some particular value. So how to do that? Again, how to just read the data and identify things, remove, check certain things, identify what types of columns you've got, etc., etc. I won't bore you with all of the details, but there's documentation here on running all of the information and kind of checking, for example, the raw data, and then once the package produces the tables, which again we'll see in a second, there's also information on styling. I think one of the key advantages of using R as opposed to Excel is that it's a lot easier to take the table and convert it into whatever format you want, make sure that it applies the style of your organization, the font, for example, is the one that you like, etc., etc. So this kind of guides you through that. So we start with kind of the raw numbers as you might see them on your machine, and then kind of changing them so they actually look better and better. And once you've done this, you should be able to reproduce and create these nice tables every time. So yeah, that's information that's there. But again, tables aren't everything. People like to see things visually. So when we look at the charts, again, this displays information from the tables that you might have. You might want to actually produce a line graph. So again, it guides you through every bit of code of how it's producing that line, and how you can change it, different colors, etc., etc. It might be that you want to create a pyramid, a depth pyramid, for example, in this case. So this is the by region, so how you could do that. But yeah, the population pyramid, you might want to generate that. And again, this is something that we've used quite a lot. But again, another powerful tool of R that we explore is around maps. So most of you will have different information for different regions, different parts of the country. So that will also be useful to show it in a map. And again, here it talks about how to get the map for your region if you don't have it already, how to plot it, and kind of different types of borders that you might want, naming them so it's easier to identify only particular ones, and then how to connect that map to the data, so that information that is potentially in a table can then be produced into a map that looks nice with nice little colors, how to change the colors, etc., etc. So that's kind of information that's here. This, we would call it the adjacent information. So it isn't the raw, how to go from the data to the tables. That is done by the package, like Pamela has said. So this is contained in this VS report package. This is the thing that has all of the functions. So this is the thing that will contain the code that does the heavy lifting. You don't need to do it. It's already there. So for example, again, all of these come with their own websites where you can kind of go in and read more about it. So for example, here there's information on how to load the package, how to install it. There is also information here in the reference on all of the functions that are in there. So these are all functions. And like Pamela has said, the naming conventions come from that Vital Strategies document. So you know that, for example, the table 4s are all around births, etc., etc. So that's what's in there. So now we have the information around, we have the package itself. Now the question is, how do you actually run it? How do you use all of these functions? and that is done by the third and final GitHub repository, which again, easily accessible through here, which is the CRVS report. This is the pipeline. This is the bit of code that you tailor for your data that then takes all of those functions and produces the tables. And in order to show you this, I'm going to show you on RStudio actually, and we can see some code. So one thing to note, so if we go to this via report, I'm assuming that people might be familiar with RStudio. If not, the setup that I have is fairly standard. But here we can see the files. So on here, CRVS report, this structure here of files and folders is exactly the same as the one that we have here. So you have your data, your reports, your docs, your outputs, etc., etc. One thing that, like Pamela said, that comes with the package is there is some test data, so that when you're getting started, you can run things and you can see what is going on. So for example, here we have, I've already loaded the data in here, but you have birth data, you have birth estimates, you have death data, you have divorce data, you have marriage data, you have population estimates. So this is the data sets that you would need for your own country, for your own situation. But there's already some test data there, so you can trial it and you can get it running, and then you can set it up. So within here, you will see in the config, there is the config.yaml. So this is the configuration file. This is the file that tells the computer where to get the data and what to do with it. So for example, here, this is what this file looks like here on the left. So we've specified the paths. And again, these are where the data is, where the process data is. And again, it will say in the documentation what each one needs to be. But then you've also got the tables and the figures that you might want to generate. And then this bit here is an important one. So this one says for each section, which tables do you want to create? Like Pamela has said, different places collect different data, which means that they will produce different tables, or they might not be able to produce a particular table in this moment in time. Or you might just want to create one because, you know, some numbers have changed, so you just want to replicate that one table. So here you can select which ones. Here for the test, I've just selected there's 3 tables from section 4. So it will generate table 4.8, 4.9, and 4.10. And then it won't generate any of the other ones. If I wanted to generate all of the ones in one section, I could just remove this, and that would tell the computer, hey, I want to generate all of the tables in section 3. You don't need to write all of them individually. So that's kind of that. And then the actual running. So for example, then you have within R, which contains the R scripts, so the bits of code that will do the hard work. Here, for example, there's a variety of scripts that will do different things. In particular, we're interested in this sample pipeline. So this is, again, we'll just use the data that is already there in the package. For those of you that are familiar in R, the same way that we're installing all of the packages, there's instructions here on how to get the VS report package set up in your machine. So then it loads that config. Yeah, that's the important first step that it does, is it loads the config, so it knows what parameters it needs to do. And then it kind of goes through the individual steps. In the interest of time, I won't run through every single line of code, but what I will do is I will just select everything and then run it. So you see it's thinking here on the left, it's doing things, and then it's running the functions for the tables, and then it stopped. And then if you go to CRVS reports, you go to outputs, you go to tables, you see you've got those 3 tables that we've just generated. Again, we've generated them right now. And then if you click on it and you view the file, this is what the table looks like in raw format. So again, it will have, it's giving you the birth rates for the different regions. Again, here We've used some generic names for the test data, so region A, region B, and region C. And again, it creates the total number of births, the adjusted number of births, and then the crude birth rate, all calculated instantaneously in there. And then this is the stage where you would then go and take that information that I showed you earlier on how to take this bit of text, these tables, convert them into a nice format that works for your organization, convert them into a nice graph, and then potentially convert them into a nice map, potentially on the different regions, so you could see that. I appreciate I might be running quick on time, so I think that's a good overview of how it works and how you'd go through the different steps. And without further ado, I will pass it on to Liana, which hopefully has joined us and is ready, if that's okay.
Liana, is there?
Sorry, I haven't been monitoring the. Could
the
most
chat.
people see the? Yeah, sorry, apologies. I wasn't monitoring the chat, but hopefully most people could see the screen.
And we had a request for French translation, and unfortunately, at the moment, Teams
My French is
doesn't.
not great.
No. Well, you know, some I think Zoom does like an automatic translation. However, Teams yet doesn't have that functionality.
Yes.
Apologies to those who were hoping for some French. Okay.
So
Liana.
I will answer the question in the chat around the R version. I think it should be fairly generic. I know we developed it on R3 point something. I've just run it on R4.4, which I don't think is the latest version. I know that it tends to work, but yeah, it should work. Anything from 3.5, I think, will be fine. Yeah. But I'll hand over to Liana. Sorry.
Good afternoon. Before I start, I just want to confirm if you can see my screen. Do I need to put my camera on?
We can see your screen.
Okay. Let me see. I can put my camera on as well. Can you see me? It's very dark, but I hope you can see me.
Yes.
Yes. Okay. I also have a short presentation just to share experience for Namibia after we got the workshop, the training on to be introduced to the R pipeline. So my name is Liana Koita. I'm a statistician at Namibia Statistics Agency, and I've been working there in the department responsible for, among other things, produce the vital statistics reports since 2014. Okay. So the outline of my presentation, I'm just going to share how we currently do produce our vital statistics reports, the process, share also then I'll share the experience and the lessons that we learned from the workshop that we had last year. And then just a few words of encouragement to our fellow NSOs, and then after some final thoughts. Okay, so currently can you see my slides before?
Yes.
Okay, all right. So currently we have been working on we've been producing our vital statistics report using the Excel and Stata So we have a team of 3 people, 2 statisticians, 3 statisticians, but we actually we have 2 people that are permanently employed, and then we usually get an additional 1 or 2 people to help us every year because of budget constraints that we can't fill in the positions. So and our process, an estimate of 12 months. It takes us about 12 months because we have to validate the data when we get it from the source, which can take about 2 to 3 months. And then we have to do the editing of the data, which includes deriving of variables. And then we do the tabulation, and then we analyze, and then we disseminate. And you can see how the process is quite long, especially the first 2 phases. It's the one that takes up most of our time because most of the work is done manually. Okay, so last year in September 2024, we requested, after we saw that ECA and ONS have partnered up to offer to introduce the R pipeline to the countries, we requested that we are also interested in the training, and we had a 1-week training where it was attended by CRVS key stakeholders in Namibia, the Namibia Statistics Agency, Office of the Prime Minister, that's the ministry that is responsible for managing the system that we use to register our vital events. And then, of course, the Ministry of Home Affairs, and then Ministry of Health. So what we learned from that workshop is, first of all, the workshop was 1 week, yeah. So we learned that this the R pipeline really was a good idea because we found it to be user-friendly, especially if you organize your work. Everything is already organized. It's just for you to know your path, like Pamela Pamela was indicating. As long as you know where you're saving your files, your outputs, it really does most of the work that we do manually. We also learned that if you actually adopt the R pipeline, it does it's very good for documentation, because the work that is done by Liana, even if I'm not here, another person can just take over as long as they change the path of the files. Then they can be able to do this analysis using the R pipeline. And we also saw the flexibility that was mentioned by Lara, where you can modify to change, to tailor make it to what is in your data. So some of the challenges that we saw for us, most of the staff that were introduced to this R pipeline, the workshop last year, we were introduced to R for the first time, so it was kind of a challenge to grasp the content, understand fully how the codes are working. But I think when you have like for statisticians and programmers, the people that are doing data management, because you already use some type of package or tool like SPSS or Stata, or it's a bit easier for you to grasp what's going on. So let me just move a bit faster. So the advice that would like to give to the other NSO is to just explore the possibility, because we have actually learned that when this package was introduced to us, you can actually see that if you adopt it, it will cut, especially for us who take about a year to produce our report, we will really cut on the time and we'll be able to produce our reports, our annual reports as expected. So please just give it a try and explore the possibility, attend the training, and then see for yourself how best you can use it for your country. So in terms of production of the vital statistics, we started producing our vital statistics reports in 2015. We started with almost nothing, or things were not in place, but looking back at where we started and where we are, I think we made a good decision to just start regardless of the state of our data. What we are envisaging to do, like in the future now for us, we are already talking to ECA and ONS on how we can best adopt the pipeline. So we are planning to have sessions that would probably be online, where we can just tailor make this the pipeline, so that we can be able to produce our vital statistics report for our 2024 data. We have also indicated the need for capacity building, and ECA has indicated that they will actually help us with that, so that we are able to really strengthen our capacity, so that we are comfortable to do the work in a more efficient and faster way. So those are the products that we have produced so far in terms of CRVS works, and we have about, we produced 6 reports, I think, yes. And then merci beaucoup. That is the end of my presentation. Thank you.
I love that. Thank you so much. Great stuff. So, if any of you have any questions, Laura, I see, has raised a hand. Please, Laura, come in with your question. Are you able to come in with your question?
I think, sorry, the microphones are not yet enabled.
I've just opened it, yeah. Are you able to speak? No? I'm unsure how to unlock Laura's microphone. Does anybody else know how to do that? Oh, I see Tuli. Hello, Tuli.
If you please, I want the link of GitHub.
You want the link for GitHub? It's in the chat.
Okay.
You see it? Hang on, I'll repost. Laura, are you able to? Your hand is up, Laura. Are you wanting to ask a question? If not, I will go to Omar. Go ahead, Omar.
Okay, thank you. Good day to you all. Good afternoon, good morning, good evening. Thank you very much for this opportunity. It's first time coming for this part of the Gambia. I just want to ask, with regard to the completeness of the CRVS data, there is a portion where it says you can get your country data set. Is it that it has encompassed all 50 or 54 states, the vital statistics, or you have to use customized data set? Because I'm not sure Gambia have one on the cloud. Can you please help me? That's the first one. With regard to the training, I'm seeing that it is piloted in 6 countries, but I haven't seen this part of the world, West Africa or North Africa. I think it's either in the southern or things like that. So when are you thinking of rolling out to this part of Africa? Those are my 2 questions, please.
Thank you, Omar. Diego, would you like to answer?
Yeah, I'm probably well placed to answer the first question. So I think maybe I misspoke, but what I meant is you can get the map for your country. So for Gambia, you will be able to load the template map of Gambia, so then you can add your data for the different regions in Gambia to that map. The underlying data on civil registration you will need to have, and we don't have any kind of way of sourcing that. That is dependent on your kind of internal organization and making sure that they have that data. So there it's like the data is expected to be in the format of each row for each event. So for example, for births, each row would be 1 birth, and Diego was born in this place on this name on this day by this person, etc., etc. That low level information you need to have independently. But yeah, the bit that you'll be able to get relatively easy is the map, as opposed to the second part of the question of when is this all coming to different parts and rolling out wider. I think that's one for someone else, ECA, to answer. Yeah.
Yeah, thank you, Diego. Pamela, do you know any more about how this might be being rolled out across more African NSOs?
Yeah, I think the countries seem to be skewed to the east and southern of Africa. One of the 6 countries was actually Nigeria, which is in the West Africa. And the way these countries were selected, it was based on demand. Countries that actually asked to be supported to develop a vital statistics report are the countries that we chose to start with, and definitely will be rolling out to the other countries as the demand arises. So you're welcome to express the demand and the need. And I also forgot to mention that sometime in October, there was a training in West Africa, in Senegal, that brought together all the countries in West and Central Africa, organized by UNFPA, and ECA was present at that meeting and presented this pipeline. Actually, a number of people went through the training, but of course, as alluded to, the time is short. So you need more in-country approaches. So that's the approach we actually took for this pipeline as a whole, to do in-country so that you have more participants attending the training and using your own data without using abstract data. So you're welcome to express the need, and we'll be available to support. Thank you.
Thank you, Pamela. I think we'll put something in the email that goes out afterwards with slides about how you come forward with a request for support with this. Nathan, would you like to ask your question? Nathan, your hand is up. Would you like to ask a question?
Yes. So thank you so much. I don't know where you are here. Are you hearing me?
Yes.
Yeah, thank you so much. My name is Sandy Nathan, right away from Rwanda. I'm very glad to join today's meeting about the ARA pipeline. So my question has a bit been answered by Pamela, but I have not got clearly the exact answer I want. So far, how I've seen that this program has so far reached in 6 African countries, and we heard that I'm from Rwanda. Do you have the number of countries that you are limited to, or planning to visit other countries just to launch that program so that it can help us also? As I also work under the civil registration and vital statistics in one of the hospitals in my country. So do you plan for us, as I've heard that if the demand is provided, maybe some measures will be provided so as we can also have knowledge and such training so that we can also get enough knowledge to make reports from using that RPI from using that program. Thank you.
Thank you for your question, Nathan. Pamela, would you like to add any more around how we might be rolling this out?
Sorry, I wanted to propose that you get all the questions, then we respond at once so that we are on time.
Thank you.
Okay.
Okay, thank you, Nathan, for your question. Let's move to Fatai for your question, and then I'm coming to Leonard for your question.
Oh, thank
Go
you,
ahead.
the Regan, Pamela, and others. I want to appreciate the ECA and the ONS for the training they had with us in Nigeria. But up to now, we had a work plan and nothing has been done on it. And I expect from what they promised us, you know, in Nigeria, unlike other countries, we have National Population Commission and National Bureau of Statistics. We have to come together. The data we need for the vital statistics reports domicile with National Population Commission. And I still want the ECA and ONS to still follow up these two organizations with these two organizations so that we can have our own vital statistic report in Nigeria. But there are some basic variables that we need. And during the training, National Public Commission was able to come up with those variables. It's just for us to have them and do the needful. Thank you.
Thank you, Fatai. And we'll take Leonard's question.
Okay, thank you, Regan. Thank you, Diego. Thank you, Pamela, for the initiative, of course, for the cause which will capacitate our countries and NSOs. My first submission is on the tool itself, like ARA. Let's say we decide to take this, and of course, we are interested in Zimbabwe to take this up. But my first submission is on ARA. Is it only a prerequisite that we to master ARA so that we proceed with the pipeline, or we can start where we are and implement? Second submission is that as Zimbabwe we are interested, maybe if you can have the contact person for assistance, like if from ECA or from ONS, if maybe we are given the contact person and the details so that we communicate on the way forward, because we are geared to start. Then the second one, I think, is need for the African countries to do like exchange programs. my colleagues from Namibia and others from Zambia or else, we can have maybe a network somewhere so that we can capacitate ourselves, of course, getting enough support from Pamela and Diego and their colleagues. I submit.
Thank you for your questions, Leonard. Would anybody like to come in and answer, first of all, from Nigeria about some follow-up, I understood, and some extra variables that might be needed?
Yeah, I can give an attempt to that. But, you know, like I mentioned, for the countries that we rolled out to, they developed action plans on how they are going to proceed to implement the activity and produce vital statistics report. So specifically for Nigeria, we were expected, the dynamics of the availability of the data and the statistics office are slightly different from many of the other countries. So the plan is we are going to follow up with you within this quarter to ensure that we follow up on the activities that were put in the action plan. So Mr. Fatai will be getting to you, I think, on a one-on-one to discuss how to move forward with the data. And also explain to you what has been done so far, since that is now really country specific. We could carry the discussion out of the webinar. Then the other question was with regard to how can the countries make the request for the training to happen? It's very simple. You just need to write, to express the interest that we are interested and we are ready. And by writing an email, the contact person at ECA is Mr. William Muhava, who is the Chief for Demographic and Social Statistics. I'll just put his email in the chat that you can communicate to, and you'll be able to get a response on how to move forward and what requirements you need to have. Of course, the basic one is the data being available for you to start analyzing. And to touch a bit on the last question from Zimbabwe, on whether you must be a master of R to be able to use the package. I think it's you don't have to be a master of R. Like I mentioned, part of the outcome of our collaboration was a training course, and the training course has a pre-training session where we introduce the country to R. But you know, R, you also need to have the interest and the hands-on and the time to always keep practicing for you to be perfect. So we try to spend the first few days to capitalize on R, to ensure that people are comfortable with R before we go into implementation of the pipeline. And then we give also follow-up. So you don't have to be a master of R, but you must at least have the R installed and the other packages. I believe Diego would want to add to that particular one. Over to you, Diego.
Yeah, I don't. So I agree with you, Pamela, that and it's good to see some familiar names and hear some familiar voices on the chat. But yeah, I think the individual country cases should be covered individually. On the level of R that is required, I think a prerequisite would be that you have an R installation, you know you have RStudio set up, and potentially you can clone the repository, and even just write a simple, print hello world kind of statement. I think if you have that kind of baseline level, then that should be good, because in practice, and one of the reflections that we've had through this, running this thing as a pilot, is that is stuff that potentially could have been done earlier and takes a bit of individual time, and it's very it can be a bit tedious sometimes. So getting that over that hurdle of kind of the initial R installation steps, that would be good. But you wouldn't need to be kind of an expert in R and know everything about R development. Like I think Liana mentioned, if you have that awareness of writing code in SPSS, in Stata, in Python, you should be okay. But it would be good to have that initial hurdle of installing RStudio, and kind of cloning the repository, perhaps. Just the things that are covered in that setup, in that R guidance link. I think it's chapter 2 in that. That's my 2 cents on that, of like what level of R would be required.
Thank you so much. In the essence of time, I'd like to try to draw us to a close. However, it does sound like there's an opportunity for you all to express an interest for this, which will be held back at the ECA, and they will manage how to ensure you all receive some sort of support to implement this pipeline. Tomorrow, we will make sure we are sharing with you everything that's been talked about today. We'll share slides. So Diego, Pamela, and Liana, if you could please share your slides with me, and I will then share them out with everybody who registered. We are going to share GitHub links, and I can see an email address has just appeared in the chat for you to contact Mr. William Muwava, the Chief Demographic and Social Statistics at the UN. And that's where you log your interest. Thank you to our speakers. A really, really interesting webinar today that's obviously piqued the interest of many here. Look forward to seeing how this progresses for African NSOs and who is able to get some training and to implement this. Some exciting times ahead, I believe. Apologies for running over. Thank you. Thank you to Pamela.
The divers.
Hello. Sarah, hello.
Hello.
Sarah, we can't quite hear you. Hello.
I want the link of divers and the marriage link on GitHub. Divers and the marriage.
Diverse and marriage link on GitHub.
Yes.
Will be shared. All the links will be shared, and she'll be able
We
to
will
access
share.
it.
We are going to share
Okay.
everything with you. Okay. It'll be in a follow-up email tomorrow with everything contained. I will also share a feedback form for you to complete. If that would be very, very beneficial for us to know how you found this webinar. Let's draw to a close. Thank you so much, everyone. Thank you to the audience for being here, and sorry for running over by 7 minutes, but thank you. Thank you to our speakers today. Liana, Diego, and Pamela. Thank you.
Thank you all.
Thank
too.
you.
Thank you. Have a good day.
Bye-bye.
Bye, everyone.
Thank you very much for the good
Bye-bye.
presentation.
Thank
Bye.
Bye.
Liana, we are knocking on your door soon.
Who is talking? Zimbabwe?
Yes,
Leonard.
you can share your email so that we do exchange programs.
Yes, it's on my, it will be shared by Siri on my presentation.
Great, thank
will
you.
get it. All right, we'll keep talking.
Okay.
Thank you,
Bye.
Liana, for the
All right,
presentation.
Thank you for listening.